Hi friends, this is Shruthi. Welcome to my YouTube channel, Shruthi, the nursing officer. Okay, as you seen previously about the what is the insulin hormone, then what are the effects of insulin if it is produced too less or the too high. So we have seen about the type 1 diabetes mellitus and the type 2 diabetes mellitus. Today we will see about the gestational diabetes mellitus. What is this gestational diabetes mellitus? The gestational, the name only suggests the woman is going to get this diabetes during the pregnancy. Then what is the gestational diabetes mellitus? It is a condition in which a hormone made by the placenta prevents the body from acting insulin effectively, which means here the placenta is going to secrete the some of the hormones in order to maintain the pregnancy. Okay, this placenta mainly plays a very important role or the barrier between the fetus and the mother. Okay, that is in case of nutrients absorption or in case of respiration or the excretion. So many functions are there. Okay, so what happens when this insulin is not properly acting during the pregnancy, which can leads to the diabetes mellitus, gestational diabetes mellitus. Okay, this is not at all caused by the lack of insulin. Okay, keep in mind here the insulin production or the pancreas is not at all producing the hormone, or it's not at all affecting the pregnancy, because here the placenta is normally secreting the insulin in order to maintain the blood sugar level, okay, blood glucose level. But what happening here, the placenta is secreting the some of the hormones. Those hormones are blocking the effect of insulin over the glucose. So what happens here, the mainly you have to know that some of the causes for gestational diabetes mellitus. So this condition is also called as the insulin resistance. Okay, insulin resistance. Here what is the resistance? Even the proper amount of insulin is producing, but because of the placental hormones, the body is not efficiently using the particular insulin in order to metabolize the sugar level. Then what are the causes? Exact causes we don't know. Okay, then here what happens, the placenta, as I said you already, the placenta acts as a barrier or the transporter in order to grow the fetus, right? If the fetus has to grow means the mother's nutrients, what the mother eats, the nutrients from the mother's bloodstream enters into the placenta. Through placenta only the baby is getting. Okay, so here what happening, mainly the placenta, I said you already, it is secreting some of the hormones. Which are the hormones? Those are the estrogen, cortisol and the human placental lactogen. Okay, so, three main hormones which are produced by the placenta are, which are those? Estrogen, cortisol and human placental lactogen. Okay, lactogen is also a form of carbohydrate or the glucose. Okay, so what this human placental lactogen does, it blocks the insulin to blocks the insulin. When it blocks the insulin properly, the sugar is not at all getting absorbed in the body or from the placenta to the baby. So only the increased levels of glucose is going to happen, which leads to the gestational diabetes mellitus. Okay, you know the pathology, right? So here the placenta is secreting estrogen, cortisol and human placental lactogen. This human placental lactogen, which acts as a blockade for the insulin to use the proper amount of glucose to absorb. Okay, so only here gestational diabetes mellitus is happening. So only it is called as contra insulin effect. So the process which we have studied now is called as contra insulin effect. Okay, contra insulin effect. Then when during at what gestational age the diabetes is going to affect means 20 to 24 weeks of pregnancy. 20 to 24 weeks means the 5 to 6 months during the pregnancy. Okay, so then what happens here, as the placenta grows, okay, even weekly the placenta is growing to grow day by day. Okay, as the placenta grows, what happens, the increased hormonal production will be there. Okay, the placental hormone levels are going to increase as the placenta grows. Then what happens, when the placental hormonal increases, there will be increased risk of insulin resistance, because here placental lactation is also getting increasing, so only there is a risk of insulin resistance become more and more, which leads to the, here what's happening, the pancreas, when the glucose level is going to high in the bloodstream of a mother, then the pancreas is unable to maintain the required amount of insulin in order to maintain this situation. Okay, so only the blood glucose level is going to increase in the pregnant women, so only it is called as gestational diabetes mellitus. As you raise the question that, madam, this is called as the the diabetes which is occurring during the pregnancy, if it can continue after pregnancy also. Okay, yes, some of the women are going to end up with the type 2 diabetes mellitus. As I said you yesterday, type 2 diabetes mellitus, this is a completely non-insulin resistance diabetes mellitus, right? Okay, then what are the risk factors, who all are going to get the diabetes mellitus during the pregnancy? Means mainly, I said you already, the overweight or the obesity is the main problem. Okay, obesity means the fat content will be there, mainly the glucose helps in the metabolism of the fat also. Okay, when this metabolism is going to get decreased, the insulin level is the pancreas is unable to produce the more and more insulin, so only we are getting the gestational diabetes mellitus. Then the family history of diabetes. Okay, if anyone previously suffering with the diabetes in our family, means there is a chance of getting the gestational diabetes mellitus. Then previous baby weight more than 4 kgs. Okay, for example, in primary case, if I carry a baby more than 4 kg, there may be a, in second gravida, may be a chances of getting the gestational diabetes mellitus. Then and the pregnant women less than 25, those who are less than 25 age, who are carrying a baby, they are more prone to get the gestational diabetes mellitus. Then pre-diabetes means before getting pregnant, maybe they are suffering with the diabetic. Okay, this during this time it's called as impaired glucose tolerance. Why it is called impaired glucose tolerance? Means even before pregnancy she is suffering with the diabetic, means again the insulin is acting more and more in order to maintain the blood glucose level. Okay, in order to function properly and in order to improve or the growth of the baby, the body is going to secrete more and more glucose, which leads to the increased blood glucose level. Then it's getting the impaired glucose tolerance. Okay, glucose tolerance will be lost. Then how we can know the particular mother is suffering with a gestational diabetes mellitus? Means we'll do the GTT, that is glucose tolerance test. Okay, we'll give a glass full of glucose which is added in a water, and we'll give it to the mother. Okay, after drinking they are going to check whether the blood glucose level is maintaining or not. Okay, if the result is positive, the mother is, if the range of the blood glucose level is more than the what more than the normal value, it is called as gestational diabetes mellitus. Then how we should overcome all these things means, as you know, maintaining the weight, good proper rest, and proper medications advised by your obstetrician. Okay, this is very important, that proper uh, amount of insulin injections has to be taken with the prescription of your obstetrician and gynecologist. Okay, so then exercising. Okay, antenatal, we have so many antenatal exercises. So everyone, the mother who are suffering with gestational diabetes mellitus has to do the antenatal exercises. Then you have to monitor the daily blood glucose monitoring is also important in order to maintain. Then we have to take the insulin injections as prescribed by the OBG specialist. Okay, so as you already know the gestational diabetes mellitus, how it causes, who are the risk factors, then what are the treatment for the gestational diabetes. Okay, I hope so you understood the today's small session regarding the gestational diabetes mellitus. All of you like the video, please like the video, share the video, and subscribe to my channel Shruthi Nursing Officer. Okay, in the next video we are going to know about the estrogen. What is the estrogen, from where it is going to produced, and what are the uses and effects of estrogen in the human body. Okay, okay, please like, share, comment, and subscribe to my channel Shruthi the Nursing Officer. Okay, bye bye. Good night.